Good morning, good afternoon for everybody. I am happy to participate in the Congress remotely. My links with the University of Faisalabad are numerous since I have had several doctoral students doing thesis in my laboratory, and I have expertised several theses which were carried out at your University of Faisalabad. I suggest you look through several graphs and diagrams at the influence on malnutrition and the harmful effects that it can have on the brain and other organs of the human being, and these through numerical values from different countries. The double burden of malnutrition is recognized by the World Health Organization as an important contemporary global health challenge. Double burden of malnutrition is the coexistence of underweight and overweight obesity at the individual, household, or population level. Addressing double burden of malnutrition is seen to be the key to achieving the Sustainable Development Goal, a set of nutritional targets to be achieved by 2030 with the goal of eradicating all forms of malnutrition worldwide. Double burden of malnutrition is currently of greatest concern in many low to middle income countries. For example, while the burden of underweight is well known and targeted by policy intervention in South and Southwest Asian countries, obesity remains neglected as a public health issue. If immediate action is not taken, significant numbers of people will develop an array of serious and chronic health disorders and incur huge health care costs due to these nutritional disorders. By undertaking the first systematic evaluation of the scientific literature on population level, on household level, in Southeast Asia, the research aimed to understand, to identify the current status of double burden of malnutrition in 8 countries, identified what can be done to improve double burden of malnutrition as a policy level, and assess South and Southeast Asian progress towards its Sustainable Development Goal target, in particular by estimating trends for and forecasting the prevalence underweight and overweight by 2030. The study also found that globally 38.3 million children are overweight, with 5.4 million and 4.8 million of them living in South and East Asia, respectively. This makes up 26.6% of the total. The figure call for immediate action. Malnutrition is responsible for more ill health than any other cause. The health consequences of overweight and obesity contribute to an estimated 4 million deaths globally. The uncomfortable question is not so much why are things so bad, but why are things not better when we know so much more than before. Let us to see about stunting obesity and anemia in low and middle income countries. An analysis of 80 countries by world regions, as classified by UNICEF, show that stunting and overweight are not randomly distributed within any given population. In all regions, stunting prevalence among children under 5 decrease with as with increase. The highest prevalence of stunting on the widest weight-driven gaps are in South Asia and the narrowest in Eastern Europe and Central Asia. Let us to see about obesity inequalities in 8 income countries. Both maternal and child obesity are more prevalent among the poor in 8 income countries. However, an initial pattern of more obesity among the wealthy is seen when where undernutrition among the poor is still the predominant problem. As previously indicated, overweight prevalence is increasing rapidly among the poor, including in rural areas and indigenous communities. Prevalence increase with social disadvantages. Additionally, inequalities affecting ethnic minority population are pronounced children in ethnic minority population living in high incomes countries, including in the United States, often experience social inequities disproportionately. The Global Nutrition Report sets out to create accountability for greater action to end malnutrition. The report is written by the independent expert group with data, guidance, and funding provided by international agencies, governments, funders, civil society, and business established in 2020. This report tracks global and national progress against nutrition targets, assess how well government, civil society, and business are doing in keeping up with the commitments they have made to address malnutrition and evaluate financing. This report also aims to challenge the community and to think and act differently for nutrition. Why do we need an independent report on malnutrition? Because rigorous accountability requires independent oversight free from public and private sector interference, and because we need more attention on malnutrition, a condition to estimate over 1 out of the people experience. In the Global Nutrition Report 2020, it shows that yet again progress in achieving globally agreed nutrition targets is too slow. At current rates, we are way off track to reach the Sustainable Development Goals and to end malnutrition in all its forms. Certain forms of malnutrition, like stunting, when kids do not grow enough, and wasting when people are too thin to be healthy, are declining, but the rate of decline is slow. Micronutrient deficiency simply are not budging. Anemia among women is shockingly high, not just in low and middle taking about there, but obesity. The data show that obesity among adults is rising everywhere, and the question is, why should we worry? Well, for starters, it's not as nice and it's not healthy for experience malnutrition for everyone. But also because for poor nutrition as holding back development. For example, stunting disrupt critical brain development that builds future and economics. Investing in nutrition supports human development through life and enhance mental and productive capacity, offering $16 run for every $1 invest. Malnutrition can have a real economic impact. For example, in the United States, obesity accounts for about 8% of household annual healthcare cost, and in China, diabetes, which can be an outcome of obesity, can mean an average income loss of 16.3% per year. Investing in nutrition is thus the same as investing in development, yet just 0.5% of overseas development assistance goes to undernutrition and only 0.01% on obesity and yet relate non-communicable diseases. For this reason, the 2020 report features as one of the few programs working to fill this gap. By providing over 130 million to support cities and countries around the world to enact and evaluate policies, the aim to curb rising rates of obesity is enabling action to happen. The more holistic to addressing malnutrition is needed, and if we are to solve one of the greatest shames of our time, that one of the most basic things we need to sustain us for a healthy, productive, happy life, nourishment is so woefully inadequate. If the Global Nutrition Report achieves one thing this year, is to make people empowered to do more because everyone can make a difference for themselves, their communities, their countries. Ultimately, this will lead to a better world free from malnutrition in all its forms. The 1,000 days from the beginning of women's pregnancy to her child's second birthday are some of the most critical for human nutrition and growth. If an infant doesn't receive enough food or proper nutrition during this time, the effects often can be reversed. Especially for children under 2, the effects of chronic malnutrition can be lifelong. Those who survive may have reduced resistance to disease and infection later in life, said Kathy Berkman, Mercy Corps Director of Health, Nutrition and Food Systems. An infant who doesn't receive the right nutrition during the window of time has a higher risk of dying during infancy and is also more likely to suffer from developmental delays and chronic health issues. These risks are especially prevalent in Africa and Asia, where malnutrition is widespread and severe. 12% of all the world acutely malnutrition children live in the Democratic Republic of Congo alone. And in countries like the Central African Republic and Pakistan, more than 40% of children are stunted. The number is even higher in Afghanistan, where 60% of children have impaired growth. When infants do get the nutrition they need, they are more likely to hit mental and physical development milestones on time and are less likely to become sick. The impact of the indicators of malnutrition analyzed in the report represent a burden to the national economy of Cambodia, estimate of more than 260 millions of 260 million US dollar annually. This amount represents, in fact, 1.7% of the estimate 2013 gross domestic products from the Ministry of Economic and Finance, and also is representing 0.9% of GPD. According to the 2030 Cambodian Democratic Health Survey, more than two-thirds of the economic burden is due to stunting of iodine deficiency disorders using the discount rates 3% and 7%. In fact, ending malnutrition in all its forms will drive a sustainable development forwards. This point needs to be emphasized more strongly in efforts to achieve and monitor the Sustainable Development Goals. Although a great deal of progress is being made in reducing malnutrition, it's still too slow and too uneven, while some forms of malnutrition, namely adult overweight and obesity, are actually increasing. Concrete action to address malnutrition backed by financing is being scaled up, but not nearly enough to meet the 2035 World Health Assembly targets, the SDG target of ending malnutrition in all its forms by 2040. Commitment on financing for nutrition will need to be ramped up significantly if we are to meet these eminently reachable global reports. A virtuous circle of improved nutrition and sustainable development can be unleashed if action to address malnutrition in all its forms can be embedded within key development sectors. Between sustainable development and nutrition is to fully realized. Significant reduction in malnutrition in all its forms are possible by 2040. The graph you can see on the slide represents prevalence of child overweight among 4-5 years old in diverse ethnic groups in England. Given the well-established excessive stunting risk among the poor and the growing concentration of overweight in socio-economically vulnerable groups, it's important to explore potential solutions to the double burden of malnutrition. In low and middle income countries and the low obesity epidemic in high income countries, at different levels of the socio-ecological model, taking into account other nutrition-related problems, including anemia. Malnutrition persists at unacceptably high levels on a global scale, despite some improvements in select nutrition indicators. Progress is insufficient to meet the 2025 global nutrition targets. Among children under 5 years of age, 149 million are stunted, 45.5 million are wasted, and 40.1 million are overweight. There are 677.6 million obese adults. Progress varies across countries and by a form of malnutrition. The latest data show that no country is on course to meet all high global nutrition targets being tracked, and just 8 countries are on course to meet 4 targets. No country is on course to meet the targets on anemia and adult obesity. In fact, countries are burdened by multiple forms of malnutrition, particularly when affected by conflicts and other forms of fragility. Addressing drivers and consequences of fragility requires more and better data to inform the design of equitable interventions. Global, regional, and national patterns marks nutrition inequalities within countries and by socio-demographic characteristics such as subnational location, age, sex, wealth, and education. Also, the data gaps are more striking for certain nutrition indicators, subnational locations, on key population characteristics such as ethnicity and disability. These data gaps prevent both improved understanding of nutrition inequalities and inform priority setting. Few challenges facing the global community today match the scale of malnutrition, a condition that directly affects 1 in 3 people. Malnutrition manifests itself in many different ways, as poor child growth and development, as individuals who are skin and bone are prone to infection, as those who are carrying too much weight, or whose blood contains too much sugar, salt, fat, cholesterol, and those who are deficient in important vitamins and minerals. Malnutrition or undernourishment is a condition that results from eating a diet in which nutrients are either not enough or are too much that the diet causes health problems. Impact of nutrition can lead to increase skill, to increase of falls, reduce mobility, low mood, weight loss, low energy, muscle wasting, increase of risk of fracture, increased risk of hospital admission, confusion, infection, reduced independence. Everyone deserves access to healthy, affordable food and quality nutrition care. This access is hindered by deeper inequities that arise from unjust systems and processes that structure everyday living conditions. This year, Global Nutrition Report use the concept of nutrition equity to elucidate the inequities and show how they determine opportunities and barriers to attaining healthy diets and lives, leading to unequal nutrition outcome. The report examined the global burden of malnutrition with an equity lens to develop a fuller understanding of nutrition inequalities. In doing this, the report pinpoint and prioritize key actions to amplify the efforts on proper progress towards ending malnutrition in all of its forms. The Global Nutrition Report calls for a pro-equity agenda that mainstreams nutrition into food systems and health systems supported by strong financing and accountability. With only 5 years left to meet the 2030 global nutrition targets, time is running out. It must focus action where the need is greatest for maximum impact. Of these countries that are home to almost half, 47.2% of all student children, 2 are in Asia, India, 46.6 million and Pakistan, 10.7 million. The study also found that globally 38.2 million children are overweight, with 5.4 million and 4.8 million of them living in South and East Asia respectively. This makes up 26.6% of the total. Where you live, you can have a significant impact on your oral health. Recently, a series of factors was determined that impact the health, known as social determinants of health. Statistics and analysis of deaths highlights 3 important physical and environmental factors that impact health. Proximity to toxic substances like air pollution, access for resources like groceries, store and health, car protects, and community design on the built environment. All of these factors can have negative oral health consequences from cavities and gum disease to tooth loss and oral cancer. Nutritional disparities and the double burden of malnutrition must be considered from a life course perspective. Research focusing on women of childbearing age living in socio-economically deprived circumstances is documented the intergenerational transmission of both stunting and obesity. Albeit less studied, paternal excessive body weight has also been associated with increased obesity risk in children. Over 2 billion people are overweight, and almost 2/3 live in low and middle income countries. Obesity among women and childbearing age and children is increasing globally. Women who enter pregnancy overweight are more likely to gain excessive weight during pregnancy, develop gestational diabetes, deliver large for gestational age or premature newborns, and are less likely to break free. In fact, children born to overnight women have increased risk of developing obesity that persists as they mature. Women then pass to their children an increased risk of obesity that persists into later life, perpetuating the cycle. Maternal stunting, underweight, and gaining less weight than recommended during pregnancy are associated with intrauterine growth restriction, which has also been associated with increased risk of stunting. As with obesity, stunting is transmitted from one generation to the next, possibly through epigenetic mechanism, and stunting is a risk factor for the development of obesity. This early onset risk is difficult to reverse after infancy, underscoring the high priority for every early intervention to achieve normal weight among all women on MEP. Intergenerational transmission of risk for malnutrition is heightened in the presence of social, economic, and gender inequities. The challenges associated with facilitating optimal pre-conception nutrition are rooted in many societal processes and sectors. These need to be tackled by equity-focused policies and system through changes in community capacity building, advocacy, and political will. As shown this figure, almost of 191 countries, in fact 95% of 188 countries, include in the global database on the implementation of nutrition action, have at least one nutrition target, in fact 84%. Have target for adult and adolescent obesity, 73% for child overweight, and 46% for anemia. Furthermore, more countries are including a fuller suite of targets. In fact, 81% have 3 or more targets, 42% have between 6 and 8 targets, and 38% between 3 and 5 targets. Only 19% have 2 targets or fewer. This figure shows a socio-economical model of correlates of double burden of malnutrition, and this figure shows the impact of individual, interpersonal, organizational, community, and policy. Malnutrition involves deficient, excess, or imbalanced intake of nutrition for proper tissue or organ function, and it encompasses both overnutrition and undernutrition. Overnutrition, in fact, is a condition of excess nutrient and energy intake over time, may be regarded as a form of malnutrition when it leads to morbid obesity. Undernutrition is caused by inadequate food supply or inability to use the nutrients in food, possibly resulting in micronutrient deficiencies, stunting low A for age, wasting low A for age, or underweight, low weight for age. The term chronic malnutrition refers to lower intake of nutrients that the body needs over a long period of time. This type of undernutrition can cause young children to be, in fact, stunted in high underweight, delayed in developmental capacities such as brain function, and more prone to disease. Additionally, undernutrition can cause swollen or bleeding gums, dizziness and fatigue, and decaying teeth, among other symptoms. Undernutrition is not as visible as severe malnutrition, hence receiving less media attention than famine or outright starvation. Nevertheless, it's much larger and chronic problem. Severe malnutrition, particularly in young children, and in fact can lead to death. In conclusion, one can say that malnutrition basically means poor nutrition or bad nutrition, and can refer to undernutrition, not getting enough nutrients, or overnutrients, getting more nutrients than you need. Malnutrition is a serious condition that occurs when a person's diet doesn't contain the right amount of nutrients, where there is a disparity between the amount of food and other nutrients that the body needs for proper growth and health, and the amount that it receives or takes in absorb. This imbalance is most frequently associated with undernutrition, but it may also be due to overnutrition. The malnutrition can impact one's health and functioning of different organs such as liver, brain, kidneys, heart, and skin. I would like to thank you for your attention.